United States crossed the grim milestone of 5 lakh COVID-19 deaths since the start of the pandemic. Why does the world's most developed country have the highest death toll? Does the vaccine rollout bring hope that this can be prevented, it can be stopped? Dr. Peter Chin Hong, infectious disease specialist, professor at the University of California, joins us live from San Francisco. I want to begin by asking you, why does the world's leading power have the highest death toll? What's your assessment of what went wrong in the United States?
My assessment is that it's very, very tragic, but not surprising that we've reached this grim milestone. And it's not the kind of world record we'd like to have. It's really because of two main things. The first is that throughout much of the pandemic in the United States, there has not been an alignment of science and politics. There's been mixed messaging. And secondly, there's not been, a national strategy until the current political administration. So most of the pandemic was characterized by states having their own destiny and their own protocols. So it's almost like having 50 different countries with 50 different strategies of approaching COVID, but yet these states have not had closed borders or disease screening at the borders. So it makes no sense from a virus perspective.
It's very interesting that you talk about the lack of a national strategy as a probable cause. Masks not being mandatory in the United States. Do you think that this could have led to more infections and therefore more deaths?
Yes, so part of the reason why this number is so tragic is that many of these deaths were preventable. A mask is a really good example because even though there were some states like California that had mask mandates, there was no national mask mandate. And again, with a patchwork response, with some in some areas, some in other areas being deficient, there were mixed messages to the people, so you didn't really know what to follow. Secondly, masks were very much politicized in the United States. So if you were affiliated with one political party, it seemed really ridiculous that you would not wear a mask as a statement, even though it's really a medical and a healthcare intervention, not a political statement.
I ask my next question with an eye on what's happening in India as well. The pace of deaths increased by holiday gatherings in the United States. How do you think holidays or gatherings or festivities impacted the death rate?
Yeah, so holiday gatherings are really key, and specifically holiday gatherings indoors, which escaped both public health purview and social media shaming. So sure, we got a lot of images of people in packed bars or on beaches gathering together. But when you look at the contact tracing data, much of the outbreak was fueled by private gatherings behind closed doors, out of the sight of much of the public. And yes, it was fueled by Memorial Day and graduation time in early summer. Then there was another surge, of course, bigger surge on Thanksgiving that went all the way to Christmas. And without a break, that was really horrific and really was worse than any other part of the year.
That's very interesting, especially in the Indian context as well. We're seeing a surge in cases in several areas, and now, gatherings, of course, have come into a lot of scrutiny and question. But I want to also ask you, speaking of the high death rate in the United States and even the projected numbers being so high, does, genetic disposition play a role?
Disposition may play a small role in all of this, but really many of us believe that much of the pandemic was fueled by preventative structural issues. So genetics doesn't play a role when you don't have a national message about wearing masks, or if you give false messages around the utility of certain drugs like hydroxychloroquine. That has nothing to do with genetics. But yes, it may play a small role, like every disease that we know about in healthcare. But when you look at data, structural racism, structural issues, system issues, political issues probably play a far larger role.
Right. Variants of the coronavirus are a huge cause here in India like they are in other parts of the world. How is the United States looking at COVID variants? Are you at all worried that these could fuel another wave?
It is possible that variants may fuel another wave of COVID in the United States, but there are not going to be any mutations if there's not replication. And for replication to occur, you need to have people, not honoring some of the preventative messages that we know about so well. And if there's a very slow and rocky vaccine rollout, that can also stymie efforts. But the variants are not going to be an issue if there are not enough noses and mouths infected with the virus. And sure, we know about the variants today, like the variant first described in the UK or South Africa or Brazil, and there's even one in California first described in Denmark. But I'm most afraid about the variants of tomorrow, the ones that haven't been described as yet, which could be fueled by unsafe behaviors or false security in thinking that the vaccine is here,
right,
so I don't need to do anything.
All right. So while you say that the vaccine shouldn't give us a false sense of security, do you believe that if enough people are vaccinated soon enough, we will be able to prevent future waves of COVID?
The vaccine is not the panacea. It's going to be a key prevention strategy, but it's not a panacea. There are always going to be variants. Not everyone is going to get the vaccine, either by vaccine hesitancy or by not being able to afford the vaccine, even though there's COVAX and the WHO efforts, and the U.S. has now been, contributing to COVAX.
Yes. Well, thanks so much, Dr. Peter Chin Hong, for joining us with your assessment. A lot of very interesting things that you've said about what's happening in the US, and of course lessons that India and the rest of the world can learn. Thanks so much for joining us. That's all we have time for on the show today. Thanks for watching.